when people suffer and live with depression and or trauma, there's an enormous adverse impact on people's intimate relationships and sexual function as well. The trauma picture is definitely best addressed, and relationships and so on are best addressed by the MDMA therapy.
Yeah, which is what it was originally started for.
Yeah, that's right.
Tell me about some success stories.
And there's a couple of clients that are coming to mind as I'm talking to you. They have reported that their marriages are definitely better. There's more conversation, there's more connection, there's more intimacy immediately, once it's...
Well, more conversation, connection leads to more intimacy, doesn't it?
So, that's right. That's the essence of it.
This is Between the Sheets by MHC, a podcast about sex, intimacy and relationships.
Some suggest that psychedelics may lead to improved sexual functioning and satisfaction. In this episode, we're going to ask Dr. Ranil what his opinion is. Great. So, Dr. Ranil, what evidence supports the use of psychedelics for improving one's sexual relationship, and can one improve their sexual function with them?
Yeah. Well, look, I have to be clear that psychedelic therapy cannot be utilised for the sole purpose, as I said earlier, of improving relationships or sexual function. Mm-hmm. What the TGA have ruled, which is important, we're all compliant with, is that it's utilised for treating treatment-resistant depression in the case of psilocybin, or trauma disorders in the case of MDMA-assisted therapy. However, that said, as we've talked about in previous episodes, when people suffer and live with depression and or trauma, there's an enormous adverse impact on people's intimate relationships and sexual function as well, as in all areas of their life, because what's common to psychiatric conditions is social and occupational dysfunction. That's in every diagnosis in the DSM categories. What isn't talked about so much is intimate relationship dysfunction and sexual dysfunction, which goes hand in hand. So treating all psychiatric disorders, not just trauma and TRD, but they all result in improvements in intimacy, in connection, and thereby sexual function. Interestingly, the movement, as we talked about earlier, where it came from, MDMA is a really interesting... people know more about the origins of psilocybin and LSD, which are classical psychedelics. MDMA is technically not a psychedelic, but it is classed in that group these days. It works very differently, and the way the movement came about was it was really in the underground, in being used in therapy in the 80s. A small group of people were exploring it, and where it started its journey of therapeutic renaissance was back then in couples therapy, actually.
Right.
Yeah, so that it wasn't. That was really where it was being looked at, because people were very convinced that the way that medicine works with therapy had enormous potential for healing relationship issues, and that includes intimacy.
They used to call it the love drug, didn't they?
Yeah, that's right.
Yeah,
that's right. And so it was looked at for a long time with people in that era for couples therapy.
Yeah, I can see why.
And sadly, it hasn't been approved for that here in Australia as yet. And in fact, it's a timely question. We, having been operating for the last couple of years, treating people with trauma disorders, we had a referral of a couple of clients who were husband and wife who both had their own trauma stories, and we really wanted to treat... So they met criteria as individuals to have MDMA-assisted therapy, but we really wanted to treat them together for part of the program. So we came up with this.
That's quite rare, isn't it?
Well, it has. It would be really groundbreaking because it hasn't been done.
Yes, right.
Since the 80s, really. not legally.
And they came to your clinic.
Yeah.
Fascinating.
And unfortunately, the sad news is we weren't permitted to do it. We came up with this. We contacted a very senior and experienced supervisor in the US and came up with a whole program on how we would do it. So it involved having separate preparation sessions, then one preparation session together, then doing separate medicine days for the two of them.
Right?
Separate medicine days, but then doing a medicine day together. And it was this mix of our existing program, but done with this kind of two parts interweaving through.
Amazing, so cutting edge.
Across the 3 months, which we
But you didn't get it across the line.
Well, we put it to our Human Research Ethics Committee, which we have to get an approval for. They were quite supportive and said this is a really pioneering idea. We'd love to see it done because it's the origins of where this whole movement started.
Absolutely.
Right? It wasn't for trauma; it was for relationships. And then, unfortunately, the TGA, which I completely understand why they made the decision, said they didn't. The approval is not for group therapy; it would be considered group therapy. And so they weren't in favour of us doing it. So unfortunately, we've not been able to treat that couple at this stage. But I think it is reasonable that the authorities that are overseeing this implementation are taking a very conservative approach. The TGA, the College of Psychiatry, the ethics committees, and the Ministry of Health in New South Wales have taken a sensibly conservative approach. And that will hopefully ensure the longevity of this movement. And one day I think we will be allowed to do that sort of work with couples, which I think would be incredibly exciting if it's done well.
Yeah, I would say. So have you a referral system from other psychiatrists that perhaps have a problem case that they just can't handle or they can't improve any further and then they would refer to you? Or would a couple or somebody going through a trauma that wants to get this addressed, would they come and see you privately, or how does that sort of work?
Yeah, what's been very interesting, we set up this service and we expected the majority of our referrals and people seeking treatment who had tried everything. I mean, and that's the nature of our clients. They've tried piles of antidepressants, antipsychotics and sedatives and ADHD drugs and and years of therapy, and we're getting some not there's a percentage of people for whom it doesn't do a whole lot, but there's a large number for whom we're getting some really spectacular results in with who have really had very minimal benefits from conventional therapy.
They've had some great results through you, isn't that brilliant?
Yeah, very, very satisfying to watch and be part of. But
are there specific cases that are pigeonholed on that success, or whole cross section?
Quite wide ranging. Yeah,
brilliant.
Very different kinds of traumas. And the million-dollar question is how long do these benefits last as well, which we don't know. We're still in early stages of follow-up. We're doing 6 and 12-month follow-ups as well to see. But to your question, the interesting thing when we set this service up, we believed in the enormous potential of this service because of the nature of the clinical experience that myself and my business partner, Bernadette Bywater, have. She's a clinical psychologist and I'm a psychiatrist, so we've got 20-plus years of experience and we know the limitations of conventional treatment for these conditions.
Yeah.
So we thought it would be really well embraced by the existing fraternity of psychiatrists and psychologists that'd be sending us referrals and things like that. And the reality, the vast majority of people who have come for treatment and sort us out have done it. It's the consumer and the client or family members contacting us, not psychiatrists and not psychologists, not GPs.
So they've just Googled, they've read, and
exactly.
Yeah.
The public are very educated around this area, especially those that suffer with these conditions. They know a lot. They're very educated consumers, and they are the ones seeking us out and other services around the country, I think, more than colleagues referring, interestingly.
Really? Okay,
Yeah.
Well, I suppose in that learning phase, I mean, you probably get more volume in all these different channels, won't you? But and if I remember correctly, it's www.evolutionmet.com. That's how people get hold of you, right?
Yeah, they just email in an inquiry. It's got information on there. We are very conscious of TGA rulings that we don't advertise MDMA or psilocybin or psychedelics. We don't talk about those words in public in terms of my business role. This is education. It's a kind of a different thing about the conditions and treatments in wide ranging. But as far as the business goes, we don't promote it as a psychedelic business because it's not allowed to do that we're not allowed to do that by the TGA rulings. So people kind of it's a very difficult challenge. Here we are running and delivering these world-class or cutting-edge treatments, but we're not allowed to tell the public about it.
Yeah,
right. So
exactly.
It's very difficult. We can't.
So one that somebody that's suffering, what would they do? They'd come see you for an initial consultation. Would they explain to me how that would work?
They usually email their inquiry in saying what they struggle with and that they're seeking psychedelic therapy, or they've got a trauma condition they need treatment for.
They've generally exhausted a few other routes. Perhaps.
Oh yeah, absolutely. It's always that they've had. They've got a treatment-resistant condition that hasn't responded to conventional treatment.
Yeah.
They will send the inquiry, and our reception staff send out a whole bunch of detailed information sheets and a questionnaire. If they wish to proceed, they fill out the questionnaire, email it back, and then we start the screening and assessment process. So there's just two-stage screening and assessment to make sure they're safe and they fully understand what's going to happen and what's involved and the risks and the potential benefits and all of that sort of stuff. After the screening process, we book them in for 3 medicine days with therapy sessions interspersed, 4 prep sessions, as I said, and after each medicine day, there's 3 psychotherapy integration sessions. I assign a couple of really good therapists to them. We have 2 therapists in for the medicine days, and
I met one of your therapists the other day. Yeah, she's lovely.
Yeah. They're real. We were very careful with who we put together for the evolution team, and they're an incredibly good therapy team, I have to say. Yeah.
Excellent. And one of those sessions is that on the same day as they've had the medicine day, or the next day, did you say? And then there's strategically placed.
Yeah, the therapy sessions are done. There's after the medicine day. There's one the very next day. And then they're spaced out a bit later.
I suppose you've got to understand, and to interrupt that pattern, you've got to really break it down quite quickly, haven't you, after that?
It's important, that window after the medicine day, really important. The other point I should make that is an important one in the public interest is the issue of cost. These are very expensive treatments, but really when you break it down, they're not compared to conventional treatment. There's varying prices all over Australia for the treatment program. What you've got to remember is in 3 months there's hours and hours and hours of therapy. There's screening and assessment. There's prep sessions, integration sessions, 3 7 to 8 hour medicine days. You've got hospital fees, medicine fees. We've got to pay our therapists reasonable money.
It's a real investment.
We're all pricing ourselves. At Evolution, we've set our pricing regime as I think it's the cheapest in the country, to make it as accessible. It's for a value reason, to make it as accessible as possible for people in the general public, and that fee still comes out at $21,000 for self-funded clients. So $21,000 is a lot of money. Not everyone has $21,000 lying around to utilise, but when you add up the amount of therapy through private inpatient admissions and psychiatric consults and psychologists and all that sort of stuff, it actually isn't that much of a difference.
No,
it's just that it's crammed into 3 months is the thing.
And they'll drop 20 or 30 grand on self-development or education or something like that. There's no better education than learning about yourself and improving life, So
for your own interests of well-being, fulfillment and happiness as well.
Yeah. Absolutely. So have you got, have you seen patients with and sort of repaired relationships through this? Because, obviously you can have 2 that are troubled or 1 that's troubled. So, tell me about some success stories.
Yeah, well, look, I have to say it's early days because, but there's no doubt that we've seen quite a few cases where people are really struggling with their relationships because the trauma is creating lots of tension in the marriage or the intimate relationship because it plays out, where trauma plays out is in intimate relationships.
Yeah.
You know, and it's also difficult for the other partner to live with someone who has a trauma disorder as well. So we're definitely seeing straight away, in the cases where it's effective, this reconnection to life and human beings and nature and the joy of life. You know, there's this sudden feelings that they didn't have before.
More present,
more connected. You know, these things that humans need, like, as I say, human connection and nature connection are fundamentally important for our well-being. So they start feeling those feelings for the first time, possibly ever, or in many decades, and that helps start developing more positive energy in the relationship. There's more conversation, there's more connection, there's more intimacy immediately, you know,
more conversation, connection leads to more intimacy, doesn't it?
So, that's right. That's the essence of it. So what I can't describe as yet, and there's a couple of clients that are coming to mind as I'm talking to you, they have reported that their marriages are definitely better and more connected and close and intimate. But whether that's translated into better sexual relationships, I'm not sure yet.
It's all so new, isn't it?
It's all very early that these people are completing the program is one reason. The second reason is I think that's a bigger piece of work. Like I said to you, with especially the couple I'm thinking of, both those poor women were severely sexually abused. And as I said to you, whilst their minds and spirit may be more open to a closer, more connected, intimate relationship, their emotional and neurological system may not be quite ready yet. Because there's, you know, whilst it may have come down a few gears, it may not be in a state that it's feeling safe enough to do that. So it's an unfolding story. I can't accurately describe where that's going as yet. But there's hope, you know. There's hope with the changes we have seen. There's enormous hope that further changes for the good will happen, which is something great.
Absolutely brilliant. You must feel so proud. What incredible business. Well
very gratifying
done.
work.
So how can other holistic approaches support the use of psychedelics in enhancing sexual function? And what is the significance of comprehensive treatment, of a comprehensive treatment strategy for addressing or improving the relationship, for example?
Yeah, that's a great question. I mean, unfortunately, there has been this drive to think of psychedelics as this drug therapy, and it's really not just a drug therapy. The medicine is an important component of the change, but equally important is the therapy that goes alongside it, the therapy that's gone before it. Remember I said to you about older women having done lots of therapy, getting good results?
Yeah.
I mean, so that therapy is really helping prepare the client for that journey. That's
before the medicine day.
Yeah. Before the whole program even starts, before screening.
That's doing
what people
your...
have done, done. And then, you know, we really strongly advocate for people continuing therapy after the program because the heart and mind are open. It's much more plastic and flexible in its thinking. And that's the time to do more intensive therapy for the next. So we don't take over any clients. We insist every client has a existing therapist for before.
Do you? I was going to ask that.
And they must have the same therapist to continue after.
Can you work with that therapist?
Yeah,
That's brilliant.
That's right. So we give them a really good handover and everything.
Good.
And then their work continues. So we don't take anyone's patients. We're just here to look after them, deliver the program, and then hand them back to do the work.
Yeah.
But so continuing therapy is really important. Number two is really just the, you know, obvious stuff of improving the way you live your life. You know, sometimes people have these realizations, I need to get out of a toxic relationship, or I need to stop drinking alcohol every day, or I need to start exercising more and looking after my physical health, because a lot of trauma, there's these implicit sort of messages in people who struggle with trauma, which is that I'm not worthy, I'm not worth looking after, and things like that. So self-care is reconnecting with self-care is really important. Physical exercise and diet, and if you need to lose weight, addressing that issue, and then the huge part is human and nature connection as well, alongside that. So all these changes will help augment the effect of the psychedelic assisted therapy program. If you just go back to the way you were living your life before, and all of its unhealthy potentially unhealthy aspects, you're really going to limit the benefits of the treatment program. So, that holistic picture is really, really important.
So important. And so, with somebody that's with a couple that has relationship problems, or someone that's having a problem in their relationship due to trauma, would it always be the macro dosing of MDMA, or would it be the LSD sort of approach? Sorry, the medical names are
psilocybin.
Yes, exactly.
Look, the thing is, it seems to me that the trauma picture is definitely best addressed, and relationships and so on are best addressed by the MDMA therapy.
Which is what it was originally started for.
Yeah, that's right. And so if you think about it, like what MDMA focuses on is it's highly relational. Where your mind, so I should explain to you the way the kind of medicine day looks.
Yeah.
So, the person there's a whole prep and process that the therapists do with them to prepare them and everything, but they have an eye mask on so that it closes the outside world. I mean, sometimes they don't. They're talking and interacting with the therapist, but quite often for a number of hours they've got an eye mask on that shuts the outside world out, and then they've got headphones on with a psychedelic music playlist. The playlist is interesting,
a psychedelic playlist.
Yeah, so music has been part of every research study to date, as far as I know, and it's always been part of the program because it helps create a mood, and then that helps the mind dive into certain areas.
Is it your choice of music, or would it be the client's?
No, it's our choice of music. It's carefully curated to bring out certain moods and tensions and have a musical journey in it. So it starts very ambient and beautiful. There's a sort of a particular playlist I've put together, curated for especially the first journey, but some people use it for a second and third. But
handy being a skilled DJ then for all this.
the musical training does help.
Yes.
The interesting thing is the way we've taken it is that it starts really beautiful and ethereal and kind of spiritual, kind of a spiritual ritual sort of calling kind of concept. And then it goes gradually into a more tribal, dark, tense sort of tone to really bring out the sort of darkness and difficulties in the mind and psyche. The client's mind will be going through different memories and experiences during this whole thing. And then the music gradually holds that tension for a fair while before rising back up into a most beautiful, beautiful kind of crescendo of lovely music. We avoid words. Words distract the mind from its internal contemplations and exploration, and then it keeps going like that. So that it goes back into a tense thing, and then back up into to just really explore the full gamut of emotional experiences. While that's happening, the client will be internal, seeing images of themselves with their violent alcoholic father, or meeting this person or that person, or
with an eye mask and headphones on.
Yeah. Perhaps going through some horrific trauma that's been too big to ever think about, so it's been cut off and inaccessible or dissociated from. But they'll be actually going through that experience in front of us with the eye mask on and but the drug is constantly modifying the experience so it doesn't overwhelm the system.
So would you be taking notes in that situation rather than dealing with it there and then? You want it all to come out of their heads, basically.
Yeah, they'll sometimes take the mask off and tell us things and then go back in and we'll write notes or prompt them with a little question to try and... I wonder whether that is worth exploring a little bit more. You know, it's very led by the patient, as I said before. I'll explain this very quickly, this concept. It's a really lovely concept that comes out of psychedelic therapy. Actually, it doesn't come out of psychedelic therapy. It comes from long before that, but certainly psychedelic therapy has embraced this concept. It's that concept of inner healing intelligence I spoke to you about earlier.
Yeah.
So in nature, there is this undeniable energy towards healing. Like if you cut a tree, it will leak sap and self-heal. If you cut yourself, immune systems move in, the same thing happens, right? Yeah. If you have a cold, the immune system moves in and kills it. And if you have a problem, you worry, you think about it, you come, and then a day or two later, you've come up with a solution, right? So it's this thing of agency and fixing and resolving and healing. And it's always active in you. When people with trauma get overwhelmed, you remember I said it's like this insult that overwhelms the whole system, and that's why there's a break. It's because it's too much for the system to cope with. When that happens, there's this, especially when it happens a number of times, people lose contact with that inner healing intelligence. And that ability, they lose agency in the belief that they can control the world. The world is being put on them as the kind of position, and they've got this concept in psychiatry. They called it learned helplessness. It's a bit like that. So what we are really importantly trying to do, amongst many other things, is to reconnect the client with their inner healing intelligence so that they are more effective. They are the master of their own healing. We're here to support and follow their wisdom. It's like the medical model on its head, you know. We're not the experts in your healing. You're the expert in your healing, not us.
You're just guiding them and making them come to their own realizations.
Yeah.
So good.
Yeah. And when they have healed themselves, that means that they...
Even more powerful.
Even more powerful. They're not reliant on the therapist anymore. That's what I loved about this whole movement the most out of as a philosophy. It was a really beautiful philosophy, having been brought up in the medical model for so many years.
Yeah, so interesting. So what precautions should individuals take when considering psychedelics for improving their relationship and perhaps their sexual dysfunction?
Yeah. Well, look, as I said, just again to emphasise, the treatments that we're doing are for trauma and treatment-resistant depression, and as a comorbid condition, relationships and sexual function can improve as a consequence of healing the trauma.
Right.
But I should say it's really important that sometimes these treatments have been delivered in the underground, so illegally in Australia and in other countries as well, and there are lots of risks associated with that. We certainly don't... Firstly, we don't advocate the use of any of these medicines unless it's legal and with a proper professional credentialed team, which is, you know, we can find in most states in Australia now. But the second thing is, in the underground, it is potentially more dangerous because the drug supply can be enormously variable. I don't think the quality of MDMA in Australia is it's quite poor.
Can kill you. Yeah.
It's quite poor. Most of it is cut with all sorts of really concerning substances, and the experience you might feel off your head, but it's not an MDMA experience. It needs to be the pure medication. You know, a question we get asked a lot is there a come down, because that's traditionally associated with recreational use. And the fascinating thing is, consistent with the MAP studies, we haven't seen any come downs in terms of moods dropping post dose day. That's what that sort of refers to.
Yeah.
But yeah, and part of that may be because the drugs are so pure. They're pharmaceutical grade, GMP quality medications. But also, you know, people are taking it during the day. It's part of a therapy experience. They're not missing sleep at night. They're not drinking or using any other drugs. These could all be factors as well. But yeah, we don't recommend doing it in the underground for that reason, and also because the therapists can be many and varied. I'm not saying there aren't good therapists in the underground. There can be. However, you can't really know for sure. And with these medicines, which are very powerful medicines to open the heart and the mind, if you aren't in really safe, experienced, expert hands, you can do more damage than good. So that's I guess
significant warnings
advice
there.
really, and again the other point I would make would be that these are not treatments for everyone. There are people do need to be carefully screened to make sure they're safe to proceed, and all of that thorough screening and assessment process is most safely done in professional hands. And you know, the way we've set up our service, we're probably the safest service in the country, I would say, because we deliver our medicine days just as a day stay in a major Tier 5 teaching hospital, Northern Beaches Hospital. So we have every support service around us. We have, you know, medical, surgical, ICU, code responses, and lots of emergency setups and safety. There's nurses and doctors all around, really.
Awesome.
Full psych team and so on. So, it's about making sure you're doing it safely and with a group that are reputable and experienced and well-trained, and understanding that these are not treatments that will suit and benefit everyone, but it's another big tool in the toolbox for fighting people's misery and suffering, which is why it's so important.
Very, very good. Congratulations. Well done on the new business. Glad it's going so well. And thanks so much for spending time with us on this podcast. I've really, really enjoyed it. It's been so informative, super interesting. And really excited for you. Congratulations. Thanks so much.
Thanks, James.
Cheers.
Great to catch up.
And that's a wrap for today's episode of Between the Sheets. Thanks for joining us. If you're enjoying this podcast, give it a like and subscribe so we can keep creating content you'll love. Check out the description below for links to our Facebook and Instagram pages to get more updates about Men's Health Clinic. And if you're experiencing any bedroom health issues, please feel free to book an appointment with us through the booking links provided. If you have questions or want to start your treatment for sexual dysfunctions, reach out to Men's Health Clinic. We offer free online consultation and provide custom treatments. Take care, everyone, and keep the conversation going between the sheets.